Our sports medicine program has physicians, athletic trainers, physical therapists, occupational therapists, and one of the things we do during the football season is on Saturday morning we have a walk-in football clinic.
Our Saturday sports clinic is actually something that I love that we have. It's an opportunity for people that are injured in a Friday night game or earlier in the week to come in and be seen quickly. There's less hassle, there's less competition for spaces, and it's all athletes, so it's all people from the region here that can come and be seen in an efficient manner.
The reason we offer this is more as a convenience for the patient and for their family members. The patient themselves don't have to miss any school, and the parents don't have to take off work.
There's nothing more important than any parent is their kid being injured on Friday night, and they would like to get that diagnosis and evaluation as soon as possible. A lot of them, they don't want to wait till Monday to find out what's wrong with them. And so we offer that opportunity for them to come in on Saturday morning at 8 o'clock till 1 o'clock in the afternoon.
We're here to provide an evaluation for kids who may have concussion-like symptoms after the game, and it's an immediate evaluation. Most of these kids we'll see, and it's not even 24 hours.
You will see a board-certified orthopedic surgeon with a specialty in orthopedic sports medicine. You'll have a chance to meet our athletic trainers, take a look at our facility, and if need be, we can evaluate with x-rays, MRI scans, bracing, and everything to get the process started to evaluate your injury and allow you to return back to your sports safely.
The last thing you want to see is your child go down. And as a physician, one of the comforting things to me to know is that that trainer that comes out to see this child is probably one of the best trained trainers in the nation. I mean, these guys are very well trained. And what's good to know is that we have 4 of those trainers in our outreach clinic. Now, those guys don't only cover Friday night football, but those guys cover the high schools that don't have trainers throughout the week.
There's a lot of outlying areas around Beaumont that don't have the services. There's schools that don't even have trainers. It's just the coaches and the kids and the school nurses. And those are the kids that we want to capture. We also want to be there to answer any questions for coaches and any staff member that's had some problems with kids who are athletes. It could happen even on our select teams outside of school, but they bring those symptoms to school, and those outreach trainers are there to provide that access.
I know a lot of our physicians are just a phone call or text message away. They're really awesome at being able to communicate with us. Sometimes a kid will get seen and I'll text that physician like, hey, this kid came in at 2:30, how did it go? And a few minutes later I'll get a text like, oh yeah, it went good, let's keep up with the rehab, or let's change this, or yeah, he's full release, no restrictions, increasement is tolerated. And it allows us to be a little bit more hands-on with the athletes too.
We use the test, the neurocognitive impact test, to get them back to play. What we're doing is we are kind of following their trajectory and how they're getting better afterwards, because the scores themselves don't diagnose a concussion. That test doesn't diagnose a concussion. The fact that they've had symptoms, that is the concussion. And from there, we look at the test scores, and the test scores should get better. And if they don't, we have to ask ourselves why, and that's where we start getting that kid to the appropriate places, to the neurologist, and working with parents.
We have a multi-specialty group that can handle just about any injury. We have foot and ankle specialists, we have hand specialists, we have sports specialists, and we have just about any specialty that you could need to help with injury prevention. So if there's any type of injury, I have a partner that is a fellowship-trained specialist in that I can refer patients to.
Working hard in rehab, physical therapy, as well as their trainers to make sure they get their strength back, to make sure they get the range of motion back after an injury. That is something that, making sure they're staying on top of it with stretching, icing, anti-inflammatories really helps with the recovery process. And majority of the times we're working with pretty motivated athletes that want to get back out and play as soon as possible. And our objective is to get them diagnosed as soon as possible, develop an individualized treatment plan for that patient, and get them back out on the field as quick as safely possible.